Okay, I think we can slowly start getting going this evening. And thank you everyone once again for joining us. When I saw the idea for tonight's webinar and the plan around it, I truly thought it was a innovative and a great way to go, especially since it is World Cancer Day. And the topic of discussing not just the medical side of cancer, which we've done a couple times, and I'm sure we will keep doing, but getting an idea of living with cancer and survivorship, because that is what World Cancer Day is actually about. It's about the people who have gone through it, the people who've come out the other end, the people who are still on that journey. And on that note, I'm going to do a slight change to tonight's normal itinerary, and I'd like to start out tonight's discussion with giving the BHF a moment to speak. The Breast Health Foundation is the organization who sets up these webinars, who makes sure they happen, who comes up with ideas, who brings all the different specialists in alongside with Prof Ben. And it's run with Louise Turner and Jenna, who are both survivors. And I believe everyone who is part of the BHF has gone through this cancer journey. And I think there's no better place to start than having a bit of a discussion with them, hearing some of their stories and where this comes from. And I almost wish we'd kicked off the year with this because it's a great way to see where the entire BHF journey is coming from and where they're sitting at right now in 2025. So without further ado, I'm going to hand over to Louise and I'm going to hand over to Jenna and I'm going to let them chat.
Hi, good evening, everyone. Thanks, Dom. Um, Always nice to have you joining us and doing all our emceeing for us. So I thought this evening, being World Cancer Day, I would quickly give you a brief on World Cancer Day and give you a bit of a background on what it's about and where it comes from. And then I'm going to hand over to Jen to give you a little bit of info on BHF. So World Cancer Day was started in the year 2000 by the Union of Cancer Control, which is the UICC. It's an international body with multiple members from all over the world. The Breast Health Foundation is not a member because I cannot justify spending 25, 30,000 Rand a year to be a member of an international organization when we come from a low to middle income country. I can use those funds far better to help our own people in South Africa. But what's so interesting about it is that every 3 years, the UICC comes up with a new theme for the World Cancer Day campaigns around the world. And the new theme for the next 3 years, starting today, is United by Unique. Okay. And the campaign is calling for a systemic shift in cancer care delivery towards a people-centered approach, an equitable and compassionate way that recognizes the unique experiences and needs of individuals affected by cancer. And having a look at that and looking at that particular statement, I was thinking about what the Breast Health Foundation does. And I was thinking to myself, UICC, you're a little bit behind because I think that's exactly what the BHF does. Jen and I, you can add on to this, or you can say to me, Lou, you've missed something here. But I think what we do from a patient perspective, you guys see a lot of it in the work we do. But some of the things that we do behind the scenes and that I'm quite involved in, and Oma gets quite involved in, is about the equitable cancer care. So Oma and I are quite staunch advocates and fight for access to treatment and access to services and patients being able to get screening in clinics. So for me, the equitable access to care is something that resonates with me from a BHF point of view. And it's nice to see that the international organizations are starting to look at campaigns about changing the way people all over the world are looking at healthcare and the health systems worldwide, because it's always been a very medical centered approach. And it's never been about the people centered approach, because at the end of the day, we as the patients, it's about us. It's about our treatment. It's about our care. It's about our journey. Sorry, I have my little kitty joining us this evening. Sorry about that, everybody. And what's really important is through this campaign, they want to emphasize the importance of delivering health and cancer services tailored to individuals' needs. And I think that's something we push really hard for at the BHF. And they want to prioritize the patient and the communities they're working in. And we push very hard from a navigation and education point of view that we need to educate our communities. Because if the communities don't understand cancer or breast cancer, how can they support their neighbor who's going through this journey? It also increases the patient's outcome at the end of the day. And one of the things that they are pushing for is cultural competency training, which is something we are trying to do at the Breast Health Foundation, telemedicine services, where we are providing that with our call line already, health literacy initiatives, and we are busy doing that with our breast assessment tool, which you can go and do online. And I think the most important thing they're emphasizing here, and I'm on the UICC website, is patient navigation programs. And at the core of the Breast Health Foundation has always been our patient navigation programs. And I think that is what we fundamentally stand for. And I think that is what we are best known for within the hospitals, government, the clinics, and the medical community, is that we have our patient navigators. And as Dom was saying, we're all breast cancer patients ourselves. So I think what the UICC is promoting with the United by Unique campaign, and what they are trying to drive around the world in a change and a shift in the approach to dealing with cancer patients. Sorry, guys, but I think the Breast Health Foundation's 2 steps ahead of them at the moment from the work we are doing. Jen, how do you want to respond to that one?
Oh, Lou.
Have I sort of jumped the gun a little bit here?
No, not at all. The last theme for World Cancer Day was close the care gap. So that was the importance of access to treatment. And as Lou said, BHF is underneath the Cancer Alliance banner and advocating a lot for access to treatment and the right and timely access to treatment. And then this year they've shifted. Having access to treatment is okay, but it's about people before patient. So I am a person, an individual, before I am a patient, and treat me as that, and create my treatment plan around me as an individual rather than around my cancer, so that we are receiving treatment according to what we want and what we expect from treatment, instead of what scientifically doctors want to get, because we might not all be aiming for the same thing. So I think that's important. And then as we come into survivorship, which we're focusing on today, that focuses even more on becoming a person and redeveloping into a new normal and a new person, because you are no longer a patient. You're no longer a full-time patient, but you're now a person again. And I think the Breast Health Foundation, as all survivors, we have a focus on that, and we're able to create a community where we can all celebrate being a survivor and make things okay when we have a scan and we're exceptionally nervous, or when we act in certain ways, when we celebrate cancer days, when we do specific things. We have a community where that's okay, that can be shared, and then it can be celebrated as well.
And I think what's also interesting is that if I look at our buddies community, we have a very diverse community. We have all the subtypes of breast cancer in the group. We've got post-treatment, during treatment, pre-treatment, etc., and treatment, different centers all over the country. And yes, the drugs are different and the treatments are slightly different, and the journey to the treatment center, how you get there and how you get home is different. But the emotional challenges, the physical challenges that everybody experiences, and the buddies are in the group, you can yay or nay me or thumbs up or thumbs down. But I think in essence, that part of the journey is similar for all of you. So it doesn't matter if you're getting a Panado or a Disprin. The fact is, the headache is still the headache. And all of you resonate with that, and all of you can share and support and laugh and cry and celebrate and scream and jump up and down. Um, but the headache's the same. It's how it gets treated might be a little bit different, but you all resonate with that and you all support each other with that. And I've been watching some of the comments on the groups and some of the photos on the groups. And yeah, it warms my because they're at the treatment together. So every third Friday, they go and sit together and they've created their own little subgroups amongst each other. And I'm sure those ladies have their own little WhatsApp groups of 3 or 4 or 5 of them. And I think that's what community is about. It's a new little community that is formed with those 3 or 4 or 5 patients. And I can tell you now that the lady that was in the, and I know this for a fact, the lady that was in the ward with Jenna when Jenna had her surgery and when she had her surgery, the two of them still communicate many years later. That's a little sub-community within a community. And I think that's something that is very unique in the cancer community. And I don't think other people who haven't experienced this journey will always get it. But again, it's about the patient, it's about the caregivers, and it's about the communities we are creating to provide support for each other, where there's a navigator running that group or helping that group, or whether it's just 3 or 4 ladies sitting together, having tea, waiting for their chemo and having a chat. And I think that's the essence about what we're doing. We're all unique. We all have a different journey. But there are basic fundamentals that are the same, and we all resonate with them. So
we all survivors.
Yes.
We all survivors. You're a survivor the day you get diagnosed.
That's so true, Jenna. Thank you so much, Louise. Thank you, Jenna. We appreciate the work you guys do and for getting this off the ground and going. On that note about talking about communities, we always like to run our webinars with a sense of community. So we welcome anyone who's in the chat to ask any questions, to contribute, to join the chat function that's happening here. And if you do notice anything that's being discussed that you want to comment on, that you want to bring to our attention, or you want to ask anyone who's here today, we welcome you to do that. I'm going to take this time now to introduce our 2 speakers tonight, not that they need much introduction. First is Professor Carol-Ann Benn, head of our Breast Care Center of Excellence. I'm sure almost everyone here at least is aware of her, if not met her in person, and has built their own relationship within this community here. And our second speaker tonight is Dr. Elizabeth Hart, who is a specialist in survivorship medicine, which is the angle that we're going to take tonight's discussion on. Not just on cancer and the treatment of cancer, but the journey and surviving it around with it. But without further ado, Prof Benn, Dr. Hart, I welcome you to turn your cameras on. Let me get you on screen and let's begin our discussion.
Hi, so my very daft looking headset is thanks in care of Tanya, who runs these things, and I just rushed in and I have sitting at her computer because I think the tech is better. So here I am. Hopefully this represents something about living the new you. Let's hope we don't have too many pictures posted of me with my bunny ears and my purple things on, but if we do, so what? Okay, so I really want to start off by saying this is such an important day. It's an important day that we should all possibly take a moment and reflect the fragility of life, about the fact that as my youngest always says, oh, there are cancer cells in your body all the time. I think cells are undergoing change, and it's due to a variety of factors that some people develop cancers and some people don't. And I often, and I don't know if I've given it before, the analogy of what happened in SARS-CoV-2, that there was a virus, it was let out of a box, everyone was exposed. Some people didn't have a positive test, some people had a positive test, didn't get sick. Some people got a little sick, a lot sick, and very sick, and unfortunately some people died. And whether the medical fraternity were quick to say, if you're elderly, if you have a compromised immune system, if you are obese, if you smoke, if you are diabetic, people with compromised immune systems, and that's really the aged population, are more likely to get cancers. But we do know that we see young people, fit and healthy young people, like we saw then, who get cancers that we can't really explain. And whereas 65% of people get a cancer who don't have any risk factors, some people have family history. And what we want to be aware, take cognizance that each person is different. Having a cancer diagnosis is traumatic. Your treatment is individualized, and that's why I'm so grateful, Liz, that you are on this talk. Okay. And you always look wonderful and classy, and here am I looking daft, but you know what? There we go. We're going to go with daft. Okay. I think how hard it is for people to deal with wigs, losing hairs, growing hairs, sometimes not growing hairs, and dealing with the sequelae of going through a cancer journey and cancer treatment. And again, as both Jenna and Louise said, it's individual. And because it's individual, it means that your survivorship treatment is also going to be individual, dealing with potential problems that you may have, whether it be from a family and anxiety, a stress, or whether it is dealing with the sequelae of the treatment. So thank you for joining us. And I'm going to just open this as a conversation, and hopefully people will butt in.
Okay.
Thank you so much. Dr. Hart, if there's anything you want to say to kick this evening off as well from your side?
No, I just want to say what an honor it is to be on with Carol today on World Cancer Day. I think it is an honor. She's had the vision for survivorship for ages already, and I'm really glad to be part of it. We're still working out how best to do this survivorship thing. And I'm just thrilled to be part of developing it, because I just think it's so important, and it's making such a difference to so many people.
Yeah. So
Thank you so much.
Dom, I use the analogy of, I think it's Captain Marvel. It's that movie where that lady has that blast, and then she has parts of her past. She's got that brown leather jacket, and she has to deal with her friends, but then she's got her new superpowers. And often going through a journey is trying to mix up what you knew, what was you, with what is you now, and coming to terms with that, and coming to terms with how you relate to people who were with you before the journey as opposed to now and after the journey, and the tremendous changes in all aspects, both your physical and your emotional well-being, that a cancer diagnosis and treatment affects. Yeah.
Thank you so much, Prof, and that's so true. So the way I'd like to go forward tonight is I have a couple talking points that we can discuss, and I can ask you to have a bit of a conversation going from, but I also want to weave in some questions from anyone who's attending. So before we start, I'm just going to once again remind anyone to ask our questions. We've had one come through already, and I'm going to put that right at the top of the list after we have our first point of discussion. But Prof, I'm going to get some of your expertise to kick off the discussion. And as Louise alluded to when she was talking, this is the start of a new period of World Cancer Day. And we're talking about a lot of the new. And something that's often asked to me is, what is new in cancer treatments? What are the latest advancements? What should we be aware of? Is this the same situation from 20 years ago, from 30 years ago, from 5 years ago? I'm assuming not. So please take it away.
So over the last 40, 50, 60 years, we've seen major breakthroughs from an oncology point of view. Where we sit today is in the concept of de-escalated and personal treatment, the understanding of prehabilitation and rehabilitation. So before you even start your treatment, speaking to people to help you guide you through your treatment. When we look at medication today, we are dividing cancers and looking at them according to what happens at a cell level. So whereas we fundamentally understand the concept of a clinical stage that someone presents at, what we know today is even with advanced stage disease, for example, melanomas and the major breakthroughs we have in immunotherapies, and even with luminal breast cancers and the CDK inhibitors, that we can now take people who have got advanced cancers and we can land up with durable and long-term outcomes similar to what we see people having to manage if you've got diabetes. We know that surgery is becoming less and less, and in some cancers is actually not even necessary. So when I trained as a registrar, we used to do staging laparotomies on people with lymphoma, take out their spleen, take out lots of glands, and now that's not necessary. We treat it medically. We look at what's happening with the rectal carcinomas and the lack of need for surgery with treatment. We start understanding with breast cancer that you don't need to do a mastectomy and a bilateral mastectomy, and it's actually advised not to. What you're doing is you're looking at the cancer, you're working out where it is, you're giving the right personalized oncology treatment, and that does not necessarily mean chemotherapy. We genetically profile tumors to understand how their brains are working, and we do small surgeries. You don't take out lots of lymph nodes anymore. So, as Gabby says, we are aiming towards a world without lymphedema. We still see it, but we should see it less and less. And I think it's important for people to know that part of the modern way of looking at cancer and cancer treatment is to know that it's your body. And as I came in when Jenna, when you were talking about, it's about the person, okay, and not about the doctor. So it's about ensuring that you have some form of good communication, that you stop putting your doctors on pedestals. Well, I mean, who wants to put someone who looks this daft anyway, near you anyway? But you want to land up saying, what are my options? What is it for me, and how can you make sure my journey is an individual journey? And then most importantly is not forgetting the patient who's gone through active treatment. And as Liz says, this is a part of cancer that we are really, really focusing on. It's about going day by day after your cancer journey, ensuring that you can be compliant on your treatment, because treatment's very difficult. How do we look at what you are on, whether it's endocrine therapy or how we're dealing with the sequelae of managing things such as neuropathy and hair loss or hair gain, understanding what it's like to be a youngster and going into menopause at an early age. How do you manage that? And moving forward, how that affects you and your family.
Thank you so much, Prof. That's a lovely way to kick us off, to seeing where we've gone, where we've changed, and the change in perspective as well. I'm going to take this moment to just cut in with one of our audience questions, and then I'm going to direct a question to Dr. Hart. So our first question of the night. Hi all. With regards to hair loss, my scalp was extremely sore and I could not touch it at all. But then after I shaved it off, it felt 70% better from that moment. What caused this? What was happening there?
So, Liz, do you want me to answer it, or do you want to?
Yeah, no, you go.
Okay, so I think when you're going through hair loss, it's very difficult, and sometimes shaving it all and letting it regrow is a better thing. But you've also got to make sure that they're not other aspects. Sometimes you can have little fungal infections, particularly around the oncology treatment. So like we said, each person is different, and if you're going to experience hair loss, sometimes biting the bullet and gently shaving off all the hair, making sure that you're looking after your scalp, and then landing up with a program in terms of when you're looking at hair growth, how you manage it, whether you manage it medically or with vitamins and supplements afterwards. So that's really what it is. But that prickling sensation is often nerve sensations. And when things are coming out in clumps, it's actually really, really difficult, and it can be quite painful and uncomfortable.
Thank you so much, Prof. I'm going to combine my next point of discussion that I wanted to ask you about with our next question as well that we had from a patient. I wanted to have a discussion on any new breakthroughs on symptom relief for our patients and particularly pain management. And that goes hand in hand with our next question, asking them to talk a little bit about neuropathy and the pain of it. And sometimes that happens during treatment and even after treatment for a long time after that.
Yeah, so neuropathy is difficult. In fact, I was very interested in a study that came out of the US where they looked at people from a African American descent who seem to have worse neuropathy with the same amount of treatment. So I do think that there are genetic aspects of it that we don't look at, and I'm often concerned we don't study it well enough. So to prevent, if you're looking at chemotherapy neuropathy, we can look at cold hands and cold gloves. We don't have often the gloves available, but you can even take those, I think they're spa gloves, which have rubber inside, and making sure that your hands and feet are cold, that helps. Looking at the vitamin Bs, but some people can get quite significant and really permanent neuropathy. So you must discuss this with your oncologist. Repair of the nerves and a decrease in the neuropathy after treatment is hard to manage. What I quite like to do, and they use a variety of medications. I'm not great on people who are already on a whole lot of treatment taking a whole lot of other medication. What you can do is take gabapentin, Neurontin, and if you crush it and you mix it with Vaseline or aqueous cream, it seems to help from a topical point of view. Remember, our skin is our biggest organ to help with the neuropathy. So you have to have a stepwise approach for each person. You have to look and see what is the degree of neuropathy, when is it happening during the treatment, what is the cause of the neuropathy, and then have a stepwise approach moving forward from that, be it supplements and vitamins such as the vitamin Bs, be it looking at other medications topical, like I mentioned, the Neurontin gel, or one step further, looking at other medications. And then if you've got it in the permanent neuropathies, you must be very, very careful when you stand and how you walk. And I actually gave a lecture on Saturday in an old age home, which was wonderful. And someone was commenting about not wanting to use her walker. She had fallen and she'd had a couple of bruises on her face. And part of the new year is I said to her, you got to funk up that walker. There was someone else with vertigo, put a whole lot of flowers on it, and realize that even though this is the new part of the you, I mean, consider it pole dancing with a difference. Take your little walk out, and because what you don't want to do is have a fall and break a hip. Bone density is another important issue. Liz, I don't know if you have anything to say around it.
Around bone density.
Or even neuropathy, yeah.
Yeah, I think the neuropathy seems to show up in different ways for different people. So I think the approach is going to be different for different people. You're going to have to be super careful if you're getting a numbness, to protect your feet. Your shoes are super important. What you're wearing, you've said a lot of things already. And then I just think that I do look a lot at nutrition and supplementation. That's part of my background. And so that's kind of what I do talk to people a lot about that, about the vitamin Bs, about the omega-3s, and the various dietary things to do to just make sure that you're getting all the right things as well. So I do talk a lot about that to people.
I think that's really important, is you've got to start simple, see what you can fix. You'd be surprised how many of us are actually malnourished in what we take in. And once you get an understanding, if you start with that and then you can move progressively, I think the answer is not just to start by throwing one complication with a whole lot of medicines at another complication, because you start getting polypharmacy and particularly be careful of too many pain medications. Pain is always worse at night. So when you're sitting at night and you feel pain and discomfort, remember it's because during the day it's a bit like being on a computer screen. When you've got your ears and you're talking to somebody and you feel less pain, because it's like having many different programs open on your computer. But when you go to bed at night, it's going down to screensaver, and the little pain fibers. I always call them like the copper fibers. They're the slow fibers, and that's why we always feel more pain and discomfort in the evening. I'm very fussy because I have a sensory neuropathy in my feet from Reichel. Okay, so I'm very careful what I use. So I'm very fussy about good shoes and you know what? It's fine today to wear a dress with a pair of tackies. We really don't have to, and we should learn that from the youngsters. You know, for us, it was always about making sure you've got the right shoes and the right heels on. And if you can't, you can't. Then just put your tackies on and your long socks on to protect your veins in your legs, and make sure you're comfy, you don't fall, and you don't slip on your sandals, and that your feet are comfy during the day.
Yeah,
Thank you so much, Prof.
exactly.
That's a good point, Dr. Hart, as well. What I'm going to do is I'm actually going to skip. There was a question that just came in right at the end that I think is going to be right up your alley, Dr. Hart. I'm going to ask it, and I'm going to also then ask us to talk a little bit further onto a topic I have here before you answer. So the first question is, when it comes to empowering patients to take back some of their own control or partnership over their treatment, and you often hear this by encouraging lifestyle changes, metabolic interventions, as well as other complementary therapies that we see, nutrition, your mindfulness, your exercise. Is there somewhere that they can go or someone they can approach to help get an optimized treatment regime and outcome,
Yes.
to understand what therapeutic diets are best or exercise? So I'm pretty
Yeah.
sure I know how you're going to answer that, Dr. Hart, but please will you also add on for me a bit of an explanation of where to focus? Everyone talks about so many different complementaries. Fix your nutrition, your psychological statement, your exercise. Taking all that on at the same time might be a little bit overwhelming. Um,
Yeah.
would you prioritize anything?
Thanks, Dom. This is exactly my wheelhouse, as Carol knows. This is exactly what I spend my life doing. With a lot of people come to me exactly for these things. So, because I think to start off with how the question started was getting back some control. I think people feel they're diagnosed with cancer and then they've funneled into this kind of tunnel that just doesn't seem to have an end, and the control is taken away from them. Their lives have been taken over by this disease, and they're running from tests and treatments and surgeries and whatever. So a lot of women feel extremely a huge loss of control and would really like some of that back. So there are things that you really do have control over. And your lifestyle certainly is the major one that you can make a big difference with yourself. And so I talk to a lot of people about these things. And firstly, obviously looking after your own health during your treatment makes a huge difference to how well you do during the treatment and how well you come out the other end. But also, it does also improve your response to the various treatments, I feel. So I look at five things, and I always talk about the 5 pillars: diet, exercise, sleep, stress management, and then relationships and community. And so those are the 5 things we deal with. And often that takes me 4 or 5 sessions to go through that with a person and actually implement those various things in their lives. I do like ketogenic diet because that was the one asked about, but I don't do an aggressive one at all. But I don't prescribe necessarily. I'm a coach by training as well as being a doctor. So what I'm trying to do is take each patient individually and work with what works for them, And I'm seeing somebody on Friday, for example. I asked her to write down 3 days worth of what she actually eats, because we'll work with that and bring in the important parts and change the important things in that. So yes, this is exactly, and I think it makes a huge difference, firstly, to you getting back your sense of control, but secondly, also to how well you cope with treatment and how well you recover afterwards. I think it makes a big difference.
Yeah, and I think everything's so overwhelming for all of us. So it's a bit like you start the new year with New Year's resolutions. And what we don't realize is we've got to stop being so hard on ourselves. We really actually have to go small bites. And you know what? If you don't get it right today, you can try again tomorrow. So if you didn't exercise today and you're just going to do a gentle walk, or you're going to walk up the stairs, or small things, I think stop trying to climb the mountain when the journey is so difficult. Rather just take little detours. And I really do think this concept of look at the view and smell the flowers. And if you take that slowly, because otherwise it's a bit like women in diet. We're going to start our diet on Monday and we get it wrong on Monday night, and then we decide, well, that's it. We'll wait till next Monday. None of us are perfect. And you're going through such trauma with the cancer. Don't be so hard on yourself. Make tiny little changes, and that just empowers you to make small other little changes.
Thank you so much, Prof. Thanks, Dr. Hart. And before we move on, what is the best way if someone wanted to get hold of you, Liz? Do they do that through the BCCE? Do they contact you directly?
I can give you my details if you like. The easiest email to remember is Dr. Elizabeth Hart at gmail.com. Or my cell phone number, I'm happy to give it. Is
I know, Dominic, it's okay, because you're going to be like me, totally inundated. What Dom will do is put up your website and everything.
Okay.
Sure.
And I love working with Liz because she's always available. So you can always
You send me the details, Dr. Hart. I'll make sure it's available for everyone who attends tonight.
WhatsApp me, guys, if you like, and I'll forward it all to Liz. Okay, she's
Perfect.
super amazing. I saw in the chat someone mentioned they were nervous of gabapentin. I'm absolutely also nervous of taking lots of medicines, but that's why I like the concept of topical and supplements and small bites. Okay, don't just load yourself up on more and more medication, and that's where also Liz can get involved and guide you as well.
Thanks, Prof. While we're answering one or two of the questions in the chat, will you please just repeat what that topical foot gel that you spoke about? Let me type it out into the chat for anyone who is interested. What was that?
So again, you're going to speak to people like Liz or your GP or your oncologist, and you take gabapentin or Neurontin, and it gets mixed with aqueous cream, and you use it topically. So in other words, the absorption in your hands and feet can help with the numbing, but it's not for people just to experiment. We don't really know because these things are not mixed in compound pharmacy, so sometimes we are making them ourselves. It's a bit like the magic mouthwash, so you've really got to sit with your pharmacy and work out how to do it, and that helps with the tingling in the hands and the feet.
Thanks, Prof. I also like to get back to some of our first questions that we got on the evening. They've been waiting patiently for us. A bit of an unusual one that I'm not familiar with, and I might butcher the pronunciation of this, but could you chat a little bit about the management of anemia due to Fasego? I don't know if I pronounced that correctly.
I need to work out how to see the chat. Okay, so I want to talk just a little bit about the fact that this is around survivorship, and anyone who has anemia needs to have a proper medical. I'm trying to work out the chat here. Right. So basically, yeah, that's a spelling problem. So I think what I want to stress here that this is not a medical consultation forum. Okay, so I'm going to ask the person who's got the concern to contact in with me separately, and what we will do is go over everything. What you have to understand is if you've got anemia, you want to know, is it intake? Okay, is it that your bone marrow is not making it? Okay, or is it a concept of that the cells are being eaten, for want of a better word? So metabolism, increased metabolism, and each person is managed individually. You need blood tests done. You should be seeing a hematologist. Okay, your GP can manage it, or your oncology specialist, and then they can work out what is the right way. So you either lose blood, you don't take in enough, you don't build enough, or you have too much destruction, and that's we see sometimes with oncology medication. So I'm going to ask that person that we separate that out. They contact in, and we'll see how we can advise them and their doctor. Okay.
Thank you so much, Prof. And that's a good point. One I'd like to speak about next is something I know you can talk lyrically on from a personal point of view, and I'm sure Dr. Hart can give us a more medical side of this. But when it comes to supplements and your cancer treatment, you hear a lot of people giving idea of what supplement is good for. Then I've also in the medical fraternities heard that some supplements are actually potentially harmful to your cancer treatment. And a lot of oncologists will discourage the use of any supplements. I know that there's a bit of a debate regarding around what is good, what is not, and some studies have been done on this. What is your comment on that?
So I'm going to let Liz mainly answer this, but I'm going to say again, each single person is an individual. So whether you're battling on anemia, on your target therapies, or whether you are wanting to take supplements around your cancer, what you need to do is understand you, okay, what your needs are, what your treatment is, and then we need to personalize it from there. So I'm not anti-supplements, and neither is Liz, but really, really, I have seen people take big doses of folate while they're on CMF and deactivate the chemotherapy. So you have to have, one of the articles I'm going to write for Buddies is Truth or Dare. What is fact around medication and what is really what we are doing, just dabbling. And I have dabbled in supplements and I've been burnt on certain occasions. And I think Liz will remember on one of our anesthetists who actually landed up with a Saturday morning in ICU on a supplement. So supplements can be good or bad, okay, but they have to be managed by people who understand and are going to communicate with your oncology doctor and work with what you can and can't take. Liz, I'm going to leave it up to you. Yeah.
Yeah. Yeah, I think there's a lot of confusion around this, and I don't have all the answers yet either. But I just think, look, firstly, I think the source of your supplements is super important, because the problem is if you're going to take a lot of synthetic supplements that are manufactured in a laboratory somewhere, it's not really the natural thing. And what happens is that it has to go through your liver, and your liver has to detoxify it, and that's not helpful when your liver's supposed to be actually detoxifying your chemotherapy. So the source of it is super important. If you're going to take a supplement, it should be from a natural source, in other words, a plant source, and then it doesn't have to go be metabolized in the same way. So that's just one sort of broad general guideline. But I also, as Prof Ben said, I do kind of tend to individualize it with people, and also discuss with the oncologists and what they are comfortable with, because I certainly don't want to interfere with what they're doing. And so I have to communicate all the time. Are they okay with what I'm prescribing or not? And if not, then the patient is not taking it. And that's the bottom line. We don't want to work against each other. We want to work in tandem, and improve the outcomes. But I do believe that supplements are a good idea, simply because you are not getting enough from your food. And when you're on these hectic treatments, chemotherapies and so on, you're often not eating as best as you could. And so sometimes they're helpful. So yeah, it's very individual. And but generally, I do think they're a good idea if you take the correct ones. And I can give you specific advice on those.
Yeah, so I think the thing is, it's what Liz mentioned earlier. It's about nutrition. Okay, so I'm just scrolling through the chat here, and I see my oncologist discourage supplements while I was on chemo. What's safe? So each chemo is different. Chemo is a little bit like antibiotics. So it's not one size fits all. So you need to be able to have the conversation on this medicine. You can have this or not. And it depends on what your nutritional status is when you start. And then I see another one here. Plastic surgeon asked me to use Ensure Gold. It helped a lot while I was on the chemo treatment. Maybe for some people that is around nutrition. Okay. So what nutritional aids are you taking in for your specific treatment to help you get through? So, and then I see another one here about, I've had breast cancer. Is it safe to have full cream milk, or should I have lactose free? Well, if you're lactose intolerant, you definitely shouldn't be having. So it's about how much we genuinely eat too much and have too many things. I'm a little anti on the concept of having foods repeatedly fried in the same fat and lots of takeaways. I try and eat as sensibly and healthily as possible, and it doesn't have to be expensive. Like taking a spinach wrap or something, yay. I think we must stop looking for massive bulks and loads of carbs and lots of, and then people talk about, oh, too much sugar. It's about how much you eat of everything, and it's the highs and the ups and downs. But having sensible moderation approach to nutrition for you. So I know I've had a whole day on coffee and green tea. Not good. Okay. So then I just need to be sensible with what I have for dinner tonight. Okay. Which is also not good, because maybe I should be having, and I keep on thinking, oats and berries for breakfast. But each person is different, and you need to make a plan for you. But you mustn't have a approach where you think one size fits all. And really, we got to stay away from big bulk food and massive amount of takeaways. If you want a pizza every now and again, fine, but it shouldn't be your staple.
Thank you so much, Prof. Thank you, Dr. Hart. I'm going to direct the conversation towards now the actual topic of tonight, survivorship. In my experience in dealing with cancer survivorship means that you're never not a cancer survivor. It's from when you're diagnosed, where it starts, till the end of time for you. When it comes to survivorship and adjusting your life to life after your cancer treatment, what can you recommend there? I see particularly we have someone in the chat who mentioned how they're a year and a half out of treatment, and they've noticed impact on their short-term memory and some impact on unable to gain weight or reduction in muscle mass. I'm sure that there's a whole plethora of different life changes that you would occur following your cancer treatment. What can we discuss on that?
Yeah, it's interesting, isn't it? I think, and that's exactly why survivorship is so important. It's because everybody, you're a survivor from the moment you're diagnosed for the rest of your life. But then you're in a unique group of people because you have unique challenges. A lot of them are similar, amongst the whole population. But the truth is, once again, there's going to be quite an individual approach with each person, and so. I mean, and that's where survivorship is so valuable, is because really I can sit down with you for 50 minutes and actually talk through, so where are you? What are you struggling with? And your journey is completely different to the next person's. And I think it's one of those, yeah, it's the reason I think that we started Cancer Survivorship as a program.
So, for example, little tips. So, do you remember when you were in standard one? Okay, so I'm not particularly good at maths or spelling, etc., but we had to do every single subject. So, we had to learn mental maths, we had to learn how all our spelling. You're doing so many things, and as an adult, you focus down one road of you do what you're good at, but you don't necessarily do what you're not good at. Then you have the added trauma of oncology treatments, etc. So you kind of feel like you've been through the washing machine and spat out the other side, and your brain is all foggy, and you've got chemo brain, etc. You have to start retraining slowly. So don't be scared to do things like, I'm going to write it down. I'm going to retrain up my brain, do a little bit on the music side, do a little bit on the, I do Duolingo, and even last night, I might be on day 1000 and almost 700 because I am an obsessive and compulsive have to win, so do it every night type surgical personality. But then Charles says to me, can you order a salad in French? And I'm like, I don't know that I can, and I'm still doing my Duolingo. But it's the concept that I'm training my brain on different things. So once you've been through the trauma, it's like a child who goes through a near drowning. You have to relearn aspects. And then if you're battling with bone mass and density, then if that is your problem, then your diet and your exercise program is going to be different. It's going to be more on a weight bearing, okay, and the type of food you're going to need to take to get that muscles bulking up a little bit is going to be different from somebody who is battling with the menopausal effects of her cancer treatment and feels like she has got that nice jelly round donut that we all have, even if we're skinny, I promise you, on our tummy. And how are we going to manage that, or how are we going to lose that 10, 15 kilos? So that is a different approach, and your diet is going to be different. in terms of managing, because if you're overweight, you still also have a low muscle mass. You're just sometimes not aware of it. So it's a different training for each person. And do not for 1 minute think that brain training is not equally important. Okay.
Absolutely.
Thank you so much on that. That is a very good point. And survivorship is a very new concept, but it shouldn't be. One thing that I also want to bring up when it comes to after your immediate cancer treatment, what do cancer survivors need to monitor when it comes to their health? And how can they do their best to reduce the risk of that terrible thought and that terrible anxiety that we all have around recurrence?
Yeah. So I think there's a new school in survivorship, and that's individualizing treatment, not necessarily having your follow-ups in the oncology suite where you have that severe trauma and anxiety when you work in. We used to, I remember when I was running the units at Barron at Gen, we used to send people for scans every 3 and 6 months. It was crazy. Now what we do is we tell people to listen to your body and get on with your life. Okay. If you've got symptoms to come in, I always say use the rule of twos. If you can have aches and pains for about 2 weeks. If it's there for longer, please see your doctor. And otherwise, if it's longer than that and it doesn't settle, we need to do scans and tests, right? And then you have to deal with the anxiety of what I call canceritis, this constant fear all the time about what's going on. And I know people with cancer, it's real. For us working in cancer, it's also real as well. That's probably why I work so hard. Then I don't have to worry about is that a mole on my breast or whatever. But what you have to do is you've got to turn around and say, what is the best way for you? Is it best for you to be managing your oncology suite and have regular checkups? Obviously, screening remains the same. Big five is breast, gynae, stomach, colon, men, if they're men on this, prostate, and skin. So make sure that you are doing your screening and your checks. Listen to your oncologist, but you've got to find the rhythm for you without being ostrich in the hole. And this is harder to do than I actually mention it, that throat grabbing anxiety of every time you feel something. And I often say distraction and focus on other things is good. Be careful of chat groups, be careful of groups, and Liz and Jenna can comment on that, where people feed into the, I had this cancer and this one I knew and this came back and that. Groups are not for everybody, okay? And community is important, but you've got to be careful not feeding yourself into, it's no different to what we went through SARS-CoV-2, where there was something on every single day. Eventually, I switched my phone off to the numbers and I listened to playlists, because every time I went in knowing how many people were dying, my anxiety would just go through the roof. And I stopped looking on Google for which doctor died and who had this, etc., because then all you are doing is you're feeding into negativity. I don't know, Liz, if you want to comment on that.
Yeah. I mean, I don't deal at all with your side of things, which is where there are specific time frames in which you need to get scans and need to get mammograms and whatever you need to do. So I don't deal with that at all. I just look at how can we get you back to being your best and healthiest self. And then, control the things that you can control. And as you said before, don't sort of get all, don't be too hard on yourself. But also, there are certain things that you can absolutely control, and know that that if you do this, then, you making sure that microenvironment in your body is as healthy as it can possibly be, and you doing what you can do. Anxiety is not a good idea for cancer. It's not good. It plays havoc with your hormones, and your cortisol levels being high and all of that does not help. And so I think it's important to work out what works for you in getting that anxiety under control.
100%.
Not drugs. There are lots of other techniques that we use and things that we can do to actually help you with that, because it's not helpful to be scared all the time.
Yeah.
That is a risk in itself, I think.
I agree.
That's such an interesting point, and I'm sure it hits home for a lot of people because you can help with the physical aspect of things, with your exercise, your diet, your medication, and everything, but the mental impact is quite severe. And managing that anxiety, managing things like mood swings, and getting your temper, because you're really put out of your comfort zone, aren't you? Do you have any advice of practical ways to try and maintain a sense of normalcy and hope and how to deal with that psychological impact?
Shall I answer?
Yep.
Yeah, there's so many different things that you can do. Firstly, what you think is everything. What's going on in your head controls what you do, and then eventually what happens in your body. So you have to manage your thoughts, and you have to manage what's going into your brain. So it's very, very important. As Professor Ben mentioned, some of these chat groups make you worse, not better. So just be careful who you need support from people. You need a community, but be careful what you're taking out of that. And then make sure you're putting positive things in your head, reading positive things. Be careful of social media and what you're actually following on that. Just watch what you're doing. And then I talk usually to clients about there are two sort of aspects to managing stress. There's the immediate anxiety, where you get that sudden panic feeling. What do you do in that moment to manage it? And those are usually breathing exercises and various things like that. And then there's the daily practice. Are you doing a meditation? Are you praying? Are you reading an uplifting book? Are you doing something, just 10 minutes, 15 minutes a day, where you're actually calming your whole system down? So there are lots and lots of ways of managing that for yourself.
I think that's so important. So for me, it's like listening to some boppy music, and I'm much to the horror of everyone says, as an academic, I read these juicy romance novels before I go to bed every night. Okay. And then, it's just easier. Then I'm like not looking at all sorts of scary things and horror movies and that type of thing. I see someone's mentioned here about mood swings and short tempers. So, being a surgeon, my kids will call me Yzma, that tiny little witch who goes, "Wah, wah, wah," and I can really sometimes have a little temper moment. But you've got to try, and again, none of us are perfect, to step outside of it. It's very, very easy when you're going through menopause, and I've been in menopause for a long time, okay? And we usually take it out on the people nearest and dearest to ourselves, okay? So what you've got to do is you've got to, like with little kids that do a timeout in the corner. If you're really, really battling, you have to time yourself out. Time yourself out so that you don't rev yourself into a mad, okay? And so whether you weepy and depressed or super cross and anxious and angry, you have to, like you talked about, in the moment. In the moment, you've got to time out, whether it's your anxiety, etc., and have tricks that you use, okay, that are going to help you to be part of your immediate family community. Because it's not acceptable to scream and rant and rave either at your children or your partner, even though they can irritate the crap out of us. Okay. But the thing is, you have to time out. Okay. Your dad is not on this, is he? Because I don't want him to say 3 words about how I don't get it right. Okay. But that's the concept, what you've got to all try and do. Okay.
Thank you so much, Prof. And that's a good point. And you brought up some interesting topics there that I might be jumping the gun, but I am aware that you recently wrote an article about, and it's either coming out on the next issue of the BHF's magazine, or it's out already, Bosom Buddies, where you specifically address a lot of the misinformation around what you get online on the medical field, some of the myths, some of the
Yeah.
where you're getting from. And we'll just quick fire one or two comments that have come up in the chat asking about hearing rumors that microwaves can cause cancer and you shouldn't use a microwave.
Okay.
Uh, um, Go ahead, but if you want to answer that one quickly, and we'll move on to the
Okay.
next one.
So the world is not a safe place, guys. Okay. Everything that's happening all the time, every little bit, what's happening at our cells, whether it's little mismatch on repair genes or the little environment around the cells that are not working. There are many things, but it's not one thing that causes cancer. Because believe me, if it was one thing, some clever businessman would have bottled it and be selling it and be costing us a fortune. Okay. So so it's a combination of factors. So it's not your lipstick or the microwave, etc. You really want to have as about a healthy life as possible, but you're living in this world. Okay. So you can't help driving down the road with the potholes in and the exhaust fumes. I often say to the guys in theatre, the diathermy smoke that we are encouraged, we see every day, can't be healthy, but that's my working environment. So you've got to live within this world, but be cognizant of what you can not have too much of. So there's a very nice saying from Matilda, what's it? Dinners don't microwave themselves. Okay. So it is very hard, I'm sure, says me, who doesn't cook or even know how to use an oven, to not turn around and chuck everything in the microwave all the time, but to have some form of balance, whether it's a salad and not the microwave, etc. So really live within this world, but be cognizant of many things in too much are bad for you. Okay. And moderation is the way to go. Liz, I'm going to let you answer on that, and then I'm going to check at this chat and see what I can answer here.
But before you hand over, Prof, quick fire one for me, because I actually
Yeah.
haven't heard of this myself, and maybe it's a new internet rumor that's gone over my head. But methylene dye?
No. No. So now we use, for a lot of the times, well, we don't really use methylene when it does sentinel lymph node biopsies. We actually use something called patent blue. But what we've been using in the unit for many, many years is an iron-based substance called magtrace, which is iron-based and natural. And actually think it actually has a protective effect and not a carcinogenic effect. Okay. So it's a bit like some of the oncology drugs. People are like, oh, does the chemotherapy, can it potentiate and cause cancer? Yes, things can affect cells in different places, but also what you don't want is the cancer to kill you. So when cancer is a parasite, it's really, really trying to take over your body. So you've really got to be sensible in terms of managing it and treating it. Liz, all yours.
Okay. Yes, I do think, Prof. Ben's actually, she touched on quite a few things there already. I mean, you've got to try and, for example, your diet, stick to as much of a natural diet as you possibly can. Cook it in the healthiest way possible. Don't use seed oils, use olive oil, avocado, whatever. There's some basic good advice there. Don't eat all this processed food. The less processed food that you eat, the less food is processed, the better it is for you. Because if you look at a packet and it's got 20 ingredients on it, you actually don't want to eat it. Just so that you actually know what you're putting in your body and you're controlling what's actually going into it. We're surrounded by toxins, by microwaves, by electromagnetic frequencies and all of that. That's just the world that we live in. You can take some basic precautions. You can switch off your Wi-Fi at night if you're worried about EMFs. You can, there's some basic. I would definitely purify your water. That is one thing I would do. Yeah, but just try and be sensible but not obsessive and go into every single ingredient that you're putting on or in your body, because it'll drive you insane, and the anxiety around that is worse for you than the actual potential toxin.
Yeah, I love that. And I'm looking in the chat here. Someone said avoided Google and then music was my savior. There's something different for everybody. Be careful. And then I see another one here on integrating repurposed drugs. And I'm actually going to talk in next on the Buddies magazine on Truth or Dare. And I've looked at everything from ivermectin and the B17 and a lot of these things. So let me give you an idea here. In the 1950s, mustard gas was used to treat cancers. Evaporon, okay? But medicine evolves, and how we evolve if we start doing studies to work out whether things work or don't work and what they work for. So thalidomide was a drug in the 50s that had horrific side effects in pregnant women were given to it, and the babies were born without limbs, and now we use it to treat lymphomas. So we don't know that some of these medicines won't be used in 5 or 10 or 15 years' time to treat cancers, but don't experiment with little things you hear because maybe. And I saw an excellent article in Nature. All these things are working on the cells. We've just got to work out how they do. So one of the ones that interests me was vitamin B17, which is a drug that's probably still available in Russia and some of the Eastern companies. They did lots of studies of it in the US in the 70s and the 80s. And the problem is the way we take it is orally. So orally, it becomes toxic from a side effect point of view. So you can't use it. It breaks down to cyanide as an oral medicine. So you don't know that in 10 or 15 years' time, they don't work out how to give it as a compound in a drip. But don't experiment with little things that you hear. Check the data. And Dominic, thanks. I think you helped me a lot with that article. New to me was something called Snoops. That's why I did Charlie Brown and Snoopy, okay? Because I thought I could use Charlie Brown and Snoopy talking about the internet. And it's the concept of how you validate what you're reading and where you're finding it. Okay.
Thank you
Yeah.
so much there. I don't know if there's anything more you want to add, but I do have one or two more questions or topics that I want to bring up that haven't been touched on yet. I know that we speak often on the nutritional, the exercise, the mindfulness and everything, but something that Dr. Hart mentioned today was the actual physical impact that stress and your mental well-being can have on it. And see, there's been a lot of agreeing with that in the chat, and a lot of people are saying the same thing. When it comes to the impact that stress has on cancer progression and management, is there specific things that we can do? Is it this the type of thing where you need to see a psychologist or get medicated for it?
So I'm gonna get Liz to answer that, but I can tell you in doing this for many years, I often see people have major stresses and then get a cancer. And my very blunt explanation is if you jump behind someone and you go boo, they get an enormous fright, their adrenaline goes like mad, and then 5 minutes later they're exhausted. Or you work really hard and go on holiday and get a cold. And I think the same thing's happening at our cell level, but we're just not medically clever enough to work out how or what's happening. So I really, really implore you just to listen to a few tips that Liz can give you about dealing with stresses that we all deal with every day. And some of these absolute traumas that we happen in our life, we can't avoid.
Mm.
So it's how do you manage what you can't avoid?
Yeah, I think that's exactly the truth of it. And I think I've sort of touched on this already, but I think you need to have kind of a daily practice, and then you need to have an immediate practice. So if you're going through very, very stressful things, you need to wake up in the morning and not just focus on this very stressful thing. You need to actually take time out of it and you can control your mind. You actually can. It doesn't have to be controlled by this thing. You can actually control it, and and that's what meditation and prayer and whatever it is you decide to do is all about. So having some sort of daily practice around that has really been shown in a lot of studies to make a huge difference to your health long term. People that do have a daily practice like that makes a big difference. And then obviously, as I did say, also in the immediacy of something of having a panic attack of some sort is having some sort of strategies around that. And breathing is the easiest way to do that. There's specific breathing exercises that we use. And then I just also think that there are some things that you can do, some therapists that I use. My reflexologist, my chiropractor, my Pilates class on a twice weekly
I've
basis.
started.
Yeah. These kind of things, they just make me feel like I'm looking after myself. It's got an amazing effect on the stress levels. And so finding out what works for you, a decent massage every couple of weeks, or whatever it is that works for you, just think out of the box a little bit and think about things that work for you. But I want to come back to the point I made right at the beginning also, is that you can control your mind and you can control what goes into it. And that's going to be so, so important in managing the stress. Find books, maybe it is a trashy novel that you read at night, something that just takes your mind out of it, really. Or maybe you need something that's a little more trying to just talking good thoughts into your head, or whatever works for you. But I think, spend a bit of time on this for yourself and work out what works for you.
Yeah,
Thank you so
thanks.
much.
So Liz, I actually took your advice, this year because I worked at such crazy hours, and I'm
Mm,
just trying to give myself like 45 minutes a day where it's just Carol time. So Pilates on a Monday and this and that, because it's so important that you try and do it. What I also want to comment on, things you can't avoid, death and divorce are traumatizing. And I always say it's like a black hole. You can't, they're either going to, when people tell me time, it's not time.
mm-mm.
It's either
What you
sucks,
do with the time.
it's either sucks you in, or you've got to distract around it. And and when you have these traumas, you've got to work out who your little team is to distract you
Mm,
around it, because it's
mm.
always going to be there. Okay.
Yeah. Community is super important. It's why it's one of the 5 pillars that I talk about. Your relationships, your community is super important. Who do you surround yourself with? Don't try and do this alone.
Yeah.
Thank you so much. I'm going to start wrapping up our webinar there, and I'm going to give a little bit of a 5-minute warning to our speakers, as well as Louise and Jenna in the background. In the spirit of World Cancer Day, I'd love to get a little comment from each of you. I'll put you all up on the screen and just have a message that comes out from you to our community that we can repeat onto our social media page. We're going to put this entire webinar up onto YouTube so that if anyone needs to rewatch it or recommend to someone else to hear what's being said today, they can see that at their own pace. So while you take a moment to think of that, Prof. Ben, I'm going to take your attention. I'm going to ask you a very difficult question, and I don't think you'd be able to answer it at all because it's something that's almost unsolvable. And I know from my own experience, not even under cancer, as a diabetic, I'm experiencing these challenges now. But when it comes to drugs being out of stock and the medication that you're on chronically, suddenly you can't get hold of, and you need to make some sort of a plan. What can we do? Is there a reason to panic at this? Something along those lines? Is there any comment you want to make? And I know that there are struggles in all different medical fields now, because I've heard working alongside you that that is occurring in oncology as well.
Yeah, so it is a problem, and I've had it for the most of December and January of certain medication not being available, and that's where I think what Liz commented on is sense of community. Okay, is people need to be able to say, hold on, we can get this here. Sometimes you need to change, okay, from one drug to another. In fact, I really want to do the study in comparing people who couldn't get Stradixin and Anastrozole and have now moved on to Letrozole, even for a month or two. And I would like to see maybe put out a form to see if they have difference in side effects, because people respond differently to different medicines. And sometimes you just have to bite the bullet, and it might not be your preferred one, but to understand that it's important to be compliant on your medicines. Sometimes not being on a medicine for a week or two is okay. Obviously, that doesn't apply to high blood pressure medicine or contraceptive pills, but we've seen it across the board. And here I really stress on community. Contact in with different people, try and work out, make sure pharmacies are working together, because we've had big problems with drug stocks, also expensive drugs. And another thing is, if you have short dated or things that you're not using, we should be able to, I know we can't prescribe things that other people have had, but just to make sure what is available. Is there a drop off in government pharmacies or something for proper pharmacies to reutilize medications, as long as they're obviously not short dated and everything is done above board, but it's a big problem. Okay.
Thanks very much for that, Prof. I don't know if Jenny and Louise are available or willing to, but I'd love to get them on screen. And let's have a little bit of a, if you were to give a message out on World Cancer Day, what would your message be? And let's put this up there. We can get it out there and we can reuse this as needs be. I have no idea how we got Louise to be upside down.
Well, that is the campaign going around the world for World Cancer Day, is put photos up on social media upside down. So I turned my laptop around. If Prof can have a funky headset, I can be upside down.
There we go. Well done, Louise.
So, message to everyone. We're all unique. And let us be unique. That is what makes us different. And that is what brings us all together in this community as well. Respect each other.
Yeah.
Support each other.
Yeah.
And how do you eat an elephant? One bite at a time. And that's how we go forward in this community together.
Absolutely. So my message would be something similar of take it one step at a time. Try and not focus on the full journey ahead. You can manage just the next step in front of you. So focus on just that next step, because you can manage that, and find a community that fills your cup. Find a community that helps you through the bad times and that you're able to find support and advice and education from, because I think that will give you extra strength as well.
Yeah. Liz?
Yes, I just want to say that we now know that survivorship is so important, and I think we're the first unit in this country to implement it properly, I think. And I'm just super excited to be part of this, and I hope it becomes a huge groundswell. And I just want people to know that you aren't your cancer. You're a person and you have other needs, and we are here to really try and support you with all of those.
That's amazing, Liz. So I just want to say, I actually put on my status, I think we must reflect and remember and work together as a team and a community to improve lives of every single person who has been touched by cancer. So privilege is mine to do this job. It gives me tears in my eyes. I'm glad I've got a funky headset on, etc. But thank you to you guys. Thank you to an amazing team without which we wouldn't be able to make such a difference. Thanks. Thank you.